Affordable Care Act, also known as Obama Care, consists of a 5-year plan to making health care affordable at a low cost or no cost for most citizens. In 2010, the new patient bill went into effect and ensured that children under the age of 19 with pre-existing conditions were not denied health care because of these conditions. The Patient Bill of Rights extended the coverage age for children under their parents' plan from age 18 to age 26. This plan also ensured that insurance companies could no longer cancel health insurance policy due to honest clerical errors completed on behalf of the consumer while completing the application process. Under the new Patient Bill of Rights, consumers have the right to receive written notification when payment is denied or service request is denied. They also have the right for an internal or external review of decisions made on their behalf. The major advantage in year one of healthcare reform is the advantage of no-cost preventative care, such as blood pressure screening, cholesterol screening, type 2 diabetes screenings, HIV tests, immunization, obesity screenings, STI, and tobacco use prevention, just to name a few. In 2011, healthcare reform introduced preventative care for members covered under Medicare, drug discounts for seniors, providing programs and services to improve care for seniors, and lowering healthcare premiums. Seniors are now eligible for 50% discount on brand name drugs under Medicare Part D. Preventative screenings for seniors were extended to cover cervical cancer screenings, diabetes screenings, flu shots, and mammograms, among others, with no deductible responsibilities paid by seniors. The Center for Medicare and Medi-Cal Innovations and Community-Based Care Transition Programs work to improve care for seniors once released from the hospital in order to alleviate readmission. Under Community First Choice option, disabled consumers can choose needed services through the community rather than nursing care facilities. During the 2011 healthcare reform rollout, insurance companies are responsible for making sure that 85% of the costs consumers pay, otherwise known as the premiums, is spent on improving the care provided rather than profit for the insurance companies. If insurance companies fail to meet this goal, they are required to return funds to the consumer in the form of rebate. During 2012, year 3, healthcare reform promoted improved hospital care, development of accountable care organizations, and the elimination of paperwork and decrease in administrative costs. During year 3, hospitals are rated and rewarded for improved quality care and are required to make the ratings publicly known. Healthcare providers receive incentives for participating in accountable care organizations, which are a group of providers that provide a variety of services for consumers. Healthcare providers are required to implement rules to meet requirements for patient confidentiality in the transition to electronic filing systems and standardized billing systems. This change will also reduce administrative costs. Year 4, 2013. State Medicaid programs receive funding to create and or improve preventative care services. Pilot programs are launched that encourage doctors and hospitals to receive a flat rate for services rather than billing each service or procedure separately. During 2013, primary care physicians are promised 100% payment for services provided to Medicaid consumers. During the 2013 healthcare reform rollout, health insurance marketplaces are established. These are resources that assist consumers with shopping for health insurance, getting answers regarding types of insurance provided, and screenings for eligibility to low-cost or no-cost Medi-Cal. Consumers are able to enroll in a health plan under California's health insurance marketplace known as Cover. 2014, Year 5 of healthcare reform, incorporates non-discrimination laws to protect consumers from denial of benefits or increase of rates due to gender or health conditions. No annual dollar limits for coverage on most health insurance plans. This law does not cover individually purchased plans, and consumers may be subject to lifetime limits. Consumers who fall between 100% and 400% of the poverty level and are not eligible to affordable coverage are eligible to tax incentives that can be applied to lower premium costs. They may also be eligible to lower copayments and deductibles. The health insurance marketplace will be available for consumers to purchase health insurance plans direct. Individuals earning less than $14,000 per year will be potentially eligible to Medicaid. Federal government will fund these changes 100% in the first 3 years and 90% in subsequent years. There is much speculation regarding the fact that if someone is not enrolled in a health plan, they must pay a tax penalty. According to the Affordable Health Care Act, consumers who cannot afford health care costs will not be penalized during tax time. Finally, we weigh our options and determine, is health care reform worth it? The advantages are sick children can be covered, no cost or low cost preventative services, tax breaks for doctors and patients, improved health care in general. Disadvantages: increased taxes, penalties for capable uninsured consumers, medical providers absorb some of the cost for services, and some people will not be able to afford coverage. You weigh the options.